Hi everyone, it's Mr. Sinti, and I'm happy today to be talking to you about the female reproductive system. And I want to wrap up some ideas about the female reproductive system and sort of connect some ideas about how that system is regulated through hormonal control. And then culminate with sort of the effects that occur inside the ovaries as a result of hormones, and then the events that occur in the uterus as a event of these, as a effect of these hormones. And so it's kind of a combination of ovarian events, uterine events, hormones coming from the brain, and the menstrual cycle, all in this conversation. So so much to talk about. Let's jump right in. And so one of the first things that I want to say about the female reproductive system is that it's controlled fairly similarly by hormones, especially similar to the male reproductive system. And so it all kind of happens up here in the brain. These are cells of the brain, and in particular the hypothalamus. And so along comes puberty, and the hypothalamus starts producing gonadotropin-releasing hormone. And gonadotropin-releasing hormone is going to get the anterior pituitary gland to start producing some crucial gonadotropic hormones. And those are follicle-stimulating hormone and luteinizing hormone. And those are targeting the ovaries. And then the ovaries are going to undergo some things. In other words, the follicle is going to mature, and then that is going to eventually ovulate. And so these hormones also, I may add, are responsible for the secondary sexual characteristics like they were in the man as well. And so one of the things that I want to say right out of the gate is, so around puberty, I know 10's a little young for that, but whenever puberty occurs, the hypothalamus is starting. So even if you haven't had a period by this time, the hypothalamus is beginning to secrete gonadotropin-releasing hormone and starting to increase. And as a result of that, inside the brain, the pituitary is making follicle-stimulating hormone and luteinizing hormone. And let me see if I can help animate this. Now, follicle-stimulating hormone does just that. It arrives in the ovary, so this is in the ovary, like that. So this is the ovarian cycle, if you will. So follicle-stimulating hormone is coming down. And what's interesting is, you recall this, that every young woman is born with all of her primary follicles. So you have a couple of 100,000 follicles that are there at birth. But when follicle-stimulating hormone comes along, it causes the follicular cells to start to grow. And when they divide, they start to increase, increase, and increase. So the follicle is starting to mature. That's what we mean. Follicle-stimulating hormone also causes meiosis to occur. And so you're going from a primary oocyte to a secondary oocyte. That's what this cell is right there, a secondary oocyte. So it's a haploid cell. Now, all of these follicular cells that are happening, this is about 1 week, this is the 2nd week right there. So all of these follicular cells that are building up are now, let me change colors for emphasis, are now producing larger quantities of estrogen. That's what they produce, estrogen. And so estrogen then travels back up to the brain. So we're going to the brain, because the brain is where gonadotropin-releasing hormone came from and follicle-stimulating hormone. So the estrogen's going back up into the brain. So a little bit higher levels of estrogen in the blood will cause the pituitary gland to secrete a big spike of luteinizing hormone. Let me go like yellow with that. So luteinizing hormone increases really rapidly at around days 12 and 13. And what luteinizing hormone does is cause a massive buildup of the follicle, and it causes ovulation to occur. So it causes the rupturing of the mature follicle. And so it's been said that luteinizing hormone causes ovulation, but really it's a combination of luteinizing hormone and follicle-stimulating hormone. And so ovulation releases the egg, So ovulation is an ovarian event that happens at around the midway point. So this is day 14 right there. So 7 and then 14, ovulation. So these remaining cells, these follicular cells, these granulocytes, these epithelial cells, they remain in the ovary. This is now out of the ovary, the egg, into the oviduct. The remaining cells become the corpus luteum, which is this glandular material that's going to secrete a tremendous amount of estrogen, a large quantity of estrogen, and a large quantity of progesterone for the first time. And so these levels are at their peak in the blood. And what's interesting about that is when estrogen and progesterone are at really high concentrations in the blood, what that does is that actually inhibits the hypothalamus from producing gonadotropin-releasing hormone, and it also inhibits the production of follicle-stimulating hormone and luteinizing hormone. It's like you don't need luteinizing hormone or follicle-stimulating hormone at this stage, and so they play an inhibitory role when they're that high. But their real main event is that estrogen and progesterone that are being produced in the ovary target the uterus, because you want the uterus to develop the endometrium. So all along it's been developing, but now it's really developing. So right here between 14 and 21, the endometrium is really building up. And then if there's no pregnancy, the corpus luteum will disintegrate, and so estrogen and progesterone will dramatically decrease, and then as a result the endometrium will be shed, and that's menstruation. And so you can look at the ovarian event as being like follicular phase, in other words, the development of the follicle, maturation of the follicle, ovulation at the midpoint of the cycle, and then the luteal phase, which is the corpus luteum doing its thing. And so that's kind of interesting. Let me take a break from the notes for a second and come back to this sort of animation of the reproductive system. And I sort of want to walk through this. So here's your uterus, here's the birth canal, there's the ovaries right there, fallopian tube. So the egg's going to be going into the fallopian tube, and here's the vagina. Okay, there's the cervix right there, cutaway. And now we're going to close up of the ovary. Now the ovary, again, you're born as a young woman with all of your primary oocytes. So all of these primordial follicles are present. They've been there since birth. But when puberty happens, it receives messages from the brain, hormonal cues, so that these follicles will start to mature. And so some of them mature during that 1 month cycle. And so as the egg begins to mature, the follicle itself starts producing estrogen, which causes the uterine lining to develop. And so these hormones basically control the reproductive cycle. I know it's a little bit confusing because there's 4 of them. There's estrogen, progesterone, follicle-stimulating hormone, and luteinizing hormone. But eventually you'll come to understand them, I hope. They're pretty interesting. And so let's get into that. So these follicles, they start to mature. And again, it doesn't just happen. Follicle-stimulating hormone comes from the pituitary gland. There it is. The brain's producing follicle-stimulating hormone. That's causing these follicular cells to not only grow and divide, but it's causing meiosis to occur. Pause. And so meiosis is occurring. So that right there is now the secondary oocyte. Look at all these follicular cells. They're really more numerous than they were before. So this is a mature follicle. When is this? This is just before ovulation. So the level of estrogen is pretty high. And so estrogen is going to travel up. Do you remember this? It's going to travel up to the brain, and it's going to cause luteinizing hormone to be produced by the anterior pituitary gland. Sorry. And so the brain's going to produce luteinizing hormone. And so that luteinizing hormone causes a rapid buildup of those follicular cells and causes the follicle to rupture. So LH basically causes ovulation. And there it is, ovulation. So now This remaining structure produces progesterone. These cells produce progesterone, and they will eventually become the corpus luteum, and that's what's building up the endometrium in the uterus. Now the fallopian tube stretches out its finger-like projections called fimbriae, and so it's sort of sweeping motion, sweeps along the edge of the uterus, and it catches it, sort of like a baseball glove catches a baseball. And then look at it, look at this. The corpus luteum for the next 2 weeks is cranking out a tremendous amount of estrogen and progesterone. Why? So that the uterine lining can be developed. Now, if there's sperm present, the egg will be fertilized. There you go. And then it will implant itself in the endometrium, and then you will have a baby. There you go. And then there'll be no menstruation, and that's how you'll know that you're pregnant, if the endometrium. Now, these remaining cells produce progesterone and estrogen. Let me just pause it for a second. So that high level of progesterone and estrogen inhibit follicle-stimulating hormone and luteinizing hormone. You certainly don't want more follicles to rupture, and you don't want any more to mature as well. So high levels, very high levels of estrogen and progesterone inhibit ovulation. And so there you have it. Okay, let's go back to this. So if the egg isn't fertilized, it's kind of sad. But if there's no sperm present, it's not going to live very long. It just disintegrates after about a day. And then if there's no embryo present, then the corpus luteum is going to break down. Estrogen and progesterone go down, and therefore the endometrium is shed. And so the uterus sheds in about 4 to 5 days, and that's called the period. And so that's around 40 milliliters of blood that are expelled during menstruation. And so there you have a little, I like that video. It's kind of, it's simple, but it's effective in many ways. And so let's take a look here, back to the slideshow. And so as we were talking about, puberty is a pretty important event, because at puberty, the ovaries really start making a lot of estrogen, and as a result of the estrogen, it not only is responsible for building the uterine lining, but it's responsible for all these secondary characteristics that are sometimes even more important than having the potential to have a baby. It develops breasts. In other words, it targets the glands, the mammary glands, and it develops. But it's not just and I'll talk about the breast briefly a little bit later. It's not just the glands that are producing milk that are enlarging and becoming. It's really the adipose tissue that what makes up the majority of the breast. And so estrogen really affects adipose tissue. And so not only is there a development of the breast, but there's development of adipose tissue here in the hips and in other locations, sort of giving a female adult body plan. And so it also affects all sorts of things, like, for example, like sebaceous glands in the skin, and so that sometimes puberty is accompanied by a little development of acne, which is never a good thing. And so the ovaries, as I was mentioning before, also secrete progesterone, which helps to build up the uterine lining as well. And so here's a real cool picture under the light microscope of a mature follicle. And you can see these granulosa cells. These are the ones, if you recall, are producing, these are the ones that are producing estrogen right here. And the higher levels of estrogen will cause luteinizing hormone to be secreted, and then ovulation. But basically, this high level of estrogen is starting to build the uterine lining. And so that's really important as well. And so when the estrogen goes up, luteinizing hormone is released, and then ovulation. It's an actual picture right there. This is the outside of the ovary. Look, there's a follicle almost rupturing. Now, I'll go over this in a future conversation when we talk about fertilization, but generally it's one egg that is being ovulated. There's one follicle that matures, but sometimes it's sort of a tie, and there's 2 follicles that are ruptured, and you have 2 eggs out there. Which means that's kind of a little bit of a joke, like meaning like 2 oocytes. So if there's two follicles, I'm sorry, if there's two oocytes that are out there, there's obviously a lot of sperm, and then you can have fraternal twins. And so that's kind of fun. Some of you may know I have fraternal twins. Look at this. This is a actual view of the outside of the ovary, and then this is what a surgeon would be looking at in vitro fertilization. So this woman was given follicle stimulating hormone, a lot of it, and a lot of luteinizing hormone. So she's sort of super ovulating right there, and you can see there's the egg being released. And the egg is not visible. You could see inside all that fluid. The egg would be inside, and so the physician will capture those eggs and then fertilize them outside of the body. And so that's kind of an awesome photograph of ovulation, the real thing. But after ovulation, you have this remaining structure, and I cannot emphasize it enough. This structure called the corpus luteum, this yellow glandular material, makes a lot of estrogen and a lot of progesterone, these two hormones. And what's the point? The point is, these are going to the uterus, and estrogen and progesterone is developing the inner lining of the uterus. It's thickening the inner lining, or the endometrium, these two hormones, in anticipation of the embryo implanting itself. And so, but if there's no embryo, the corpus luteum will eventually break down or decline, and then the uterine lining is shed. And so ultimately that's the breakdown of the corpus luteum is ultimately the reason for menstruation. And so this is a really important diagram. And the reason I think it's important is because, you know, we've been talking about so many different things, and here's a picture with all of it all in one slide. So these two hormones. You should be able to identify this. These two hormones, LH and FSH, are gonadotropin hormones that are produced by the anterior pituitary gland. These two hormones, estrogen and progesterone, are ovarian hormones. This is what happens in the ovary. This is the ovarian cycle, if you will. And then check this out. This is a close-up of the endometrium inside the uterus. So just to sort of start with that, you can see in day one, usually day one is considered to be, let's just talk about that, day one of a 28-day cycle. So that's 4 weeks. Day one is considered day one because that is the first day of the period. So your first day of your period, your first day of menstrual flow, is right there, day one. And how long does that take place? It takes place a few days. So let's go 5. So 5 days of bloodshed right there. Okay, that's what's happening. And then after that, the endometrium is thickening and thickening. When I say thickening, it just means that there's capillaries developing and cells are dividing, and it's becoming this sort of really good fertile environment right there. Look how thick it is. And this is, again, inside. There's another side to this, inside of the uterus. And so here's your question. Why is the endometrium thickening? It's getting, look at this, it's proliferating. So at first there's a menstrual flow, and then there's proliferative. And then, you know, like what's going to happen? Well, it's going to decline on day 28, which then it's going to start bleeding again. So it's a cycle. It goes back to this. And so why is it building up? You may recall this. It's building because the hormone estrogen and progesterone, and where do those come from? Comes from the ovary, are being produced. Now let's look up here. Here's the blood concentration of it. Look how high estrogen is right there. Estrogen and progesterone. Why are these levels very high of estrogen and progesterone? Because the corpus luteum is making them. And why are they making them? To build up the endometrium. Do you recall that high levels of estrogen and progesterone also inhibit the production of luteinizing hormone and follicle stimulating hormone? Notice over here, so there's very little progesterone because It's really the corpus luteum that produces a lot of progesterone. But check this out. As the follicle is maturing, why does the follicle mature? Because follicle stimulating hormone is increasing from the brain, so causing the follicular cells to develop. And as a result of the follicular cells developing, right there, this follicular cell is making estrogen. And so notice how when estrogen gets really high individually, that causes the brain to produce a high amount of luteinizing hormone, which results in ovulation. But check it out. Why does estrogen really drop off suddenly like that? Well, if this is the cells, these are the cells that are producing estrogen, I mean, this is a really dramatic event. The follicle ruptures, and so the estrogen kind of falls off a little bit, and then it has a chance to recuperate and then reestablish itself. You see that right there? So there's kind of a lot going down, needless to say. And so this female reproductive cycle sort of culminates. Everyone likes to talk about menstruation because that's sort of what people care about. And the menstrual part of the reproductive cycle is about, like I said, a couple of days, and there's about 40 milliliters or cubic centimeters of blood that are released. And it's started by follicle stimulating hormone as the follicle matures inside the ovary. But ultimately, it's the breakdown of the corpus luteum that is going to cause the endometrium to be shed. And then I want to emphasize this. During the cycle, estrogen and progesterone inhibit follicle stimulating hormone and luteinizing hormone, as I mentioned before. Now, what's interesting is, let me go back a slide. Do you notice here, like right before the period, right before you get your period, do you notice here, look what's happening to the levels of estrogen and progesterone. So a couple days before the period, like that's maybe 3 days before the period, the levels of estrogen and progesterone are really, really dropping off the table there. They're really going down. And so sometimes there's some side effects to this. Sometimes there's an increased gaining of water and bloating, and sometimes there's some behavioral events, some irritability, there's some tiredness. Sometimes this is known as because it happens before menstruation. It's called premenstrual syndrome, or PMS. And so this can be pretty dramatic in some females. And so sometimes people think that those kinds of behaviors are like, it's just an excuse for somebody to be rude or irritable or whatever. I don't think so. I think these hormones play roles. I mean, I can't get into every single detail of this, but there's a lot of effects on behavior, and so I'd say it's pretty real. And not to mention but the cramping that occurs I'm not even mentioning that when the uterus contracts in order to release the endometrium is kind of a troublesome situation. I can't really speak to it personally, but I understand it's very painful. And so here is a picture from our textbook here showing the endometrium thickening as you move on through the cycle. The reason that it thickens is because of estrogen and progesterone, which are really high. It comes from the corpus luteum. I love this corpus albicans, this little white nothing here. That's why estrogen and progesterone drop, and that's what causes menstruation to occur. But I wanted to transition by mentioning one final time is that the high levels of estrogen and progesterone inhibit luteinizing hormone and follicle stimulating hormone. And like, why would I say that? Well, I'll talk about that in a moment. Well, this menstruation occurs from puberty, and it's not going to last an entire lifetime. You reach a point, sort of middle-aged. What will it be? It's different for each person. Sometimes people say that if you started your period early in life, then you'd reach menopause, which is the stopping of the menstrual cycle early. I don't know that that's true. But what we can say is when the hormone levels start to decrease in the brain, and there's less gonadotropin releasing hormone, and then less LH, less FSH. What starts to happen is ultimately the whole cycle begins to shut down. And I think biologically it's a good idea, because you don't really want someone who's a little too old to be bearing children. So it's kind of a young person's thing. And so menopause occurs, and I thought I'd put in this little joke here about how sometimes there's some side effects that occur when estrogen levels go down and progesterone levels go down to all-time lows during menopause. You'd think you'd celebrate this. You're like, yay, no more menstruation. But for about a year, approximately, you go through some of these troubles. And so again, you can see a physician, and you can be given hormone therapy, and you can be maintained and sort of have some relief. And so talk a little bit about the mammary glands, which produce milk. I'll talk more about the mammary glands when we get into pregnancy. But the mammary glands are accessory, but they're really important because they're exocrine glands. In other words, they produce secretions to the outside through ducts, and they come out through the nipple right there. And so the point of it is that milk is nutrients for the baby, and this is where the baby's going to be drinking and getting all the protein, all the water, all the sugar, all the immunoglobulins, everything that the baby needs to grow is located in milk. It's quite wonderful. This pigmented area around the nipple is called the areola, and people like to talk about, like, well, what's the point of that? Well, it's hard to say exactly the case, but it's I've heard some people speculate that it kind of creates a contrast between the other parts of the breast, and therefore the baby has a better idea of where to latch on, sort of like a target. I'm not sure. So as you can see, the breast, here's a cross section of it, the breast is mainly fat. And so I know breasts come in different sizes and shapes, but basically every female has the same size glands, these milk-producing alveolar glands, or mammary glands as they're commonly known. Milk is being produced, travels through these ducts, through this one center nipple right there, and then the baby latches on. It draws the milk out. And I'll talk more about the hormone oxytocin, which helps to move this, and the hormone prolactin that develops the breast more extensively during pregnancy. But I thought I'd mention it. But it's the adipose tissue that really defines the breast, and especially the size of the breast. And so I wanted to point that out. And then just to sort of wrap up the conversation, everything I've been saying thus far has sort of been, what needs to be done in order to achieve pregnancy, which is a great and wonderful thing. But then sometimes people don't want to have, they want to voluntarily regulate when they get pregnant. And so this is known as birth control. And so there's a variety of contraception that can be used. And I mentioned this before in a previous video. Coitus, which means sex, interruptus, means where the penis is pulled out of the vagina before ejaculation. I'd say it's probably the worst possible birth control. When I say worst, it has the lowest percentages. You can look up the percentages of some of these on the internet. It's kind of interesting. This is tragic. This isn't going to happen. It's very difficult to, in the moment, to be able to control that, for one thing. Not to mention the emission, which is the movement of semen through the body. There's a little bit of semen that's going into the female, and so this is terrible. The rhythm method, not to mention that it doesn't block sexually transmitted diseases, is not good. Rhythm method is trying to bring to bear your knowledge that you now have on the female reproductive cycle. Your knowledge is, geez, only fertilization, pregnancy can only take place when I'm ovulating. So if I know when I'm ovulating, so around day 13, 14, 15, 16, so right in that little window, that week, that's the time, if I don't want to become pregnant, not to have sex. And so all the other times are good to go. Not so true, because sometimes wanting to have sex during your period is not, it may be a safer time, but it's not necessarily preferable. And so sometimes there's been pregnancies occurring at all points along the cycle, and sometimes events in your life will throw off your cycle. And so it's difficult to know exactly what rhythm it is you're talking about. So it's been known that Catholics perform the rhythm method, and I think that says enough. It's not reliable. Not to mention, it doesn't block against sexually transmitted diseases. Now, mechanical barriers are things like a condom, a latex condom. Now, that's a pretty good barrier. It prevents the sperm from even entering into the female reproduction. It also prevents sexually transmission diseases. It's a good one. Chemical barriers are like spermicides or different chemical agents that will destroy semen. Again, if it's used along with mechanical barriers, a little bit better. Alone is not a good birth control. Oral contraception, in other words, the pill. So if you're taking a contraception like an oral pill, what's inside the pill? Here's an interesting question. Like, what would you take that would affect, let me go back a picture over here. Let's go back. What would you need to take to prevent ovulation? In other words, what would you do to prevent this event? What would you do to prevent luteinizing hormone and follicle stimulating hormone? Remember before I said that when the corpus luteum is making a high amount of estrogen and progesterone, it inhibits, let me do this, it inhibits luteinizing hormone and follicle stimulating hormone. So how about if you're taking a birth control pill for the first week, and there's no need to put too much hormone in it, there's not much of happening, but how about in the second week, right in here, that second week, inside the birth control pill, you put a high concentration of estrogen and progesterone. That will prevent ovulation. And I would put a little bit of high estrogen and progesterone in the second week, the third week, just in case. And then in the fourth week, maybe I wouldn't put much hormone at all in it. It would be sort of like a placebo. So not so much hormone in the fourth week, not so much in the first week. And so that way, the body just naturally does what it does. In other words, estrogen and progesterone come down and you have your period. This way you prevent ovulation. And so the birth control pill is a very effective, very successful means of preventing pregnancy. But the thing about the pill and injectable hormones and implant hormones that you can put in below the skin, all of these are very effective, but you have to be in a committed relationship, i.e. like a marriage, for this to be effective. Because if you're sort of, moving around between partners, it's not preventing sexually transmitted disease. And so this is not safe sex. It's not safe to do it, if you understand what I'm getting at. Now, the intrauterine device, or IUD, is a physical sort of plastic-like device that sort of looks like a T that is inserted. Usually a doctor needs to do this. It's inserted into the birth canal through the cervix into the uterus. And what it does is it sort of disrupts the inside endometrium formation. And so the embryo would never be able to establish itself inside the uterus, and therefore pregnancy cannot take place. And then surgical methods. I mentioned in a previous video we were talking about a vas deferens. In other words, the tying of the vas deferens and preventing that. I could have also mentioned in the female, when you're talking about fallopian tubes, you can also have your tubes tied. In other words, you can surgically go in there and cut those fallopian tubes and then tie them off. And so therefore, the sperm would never be able to reach the egg. And so it's a very effective tubal ligation, it's called. It's very effective, but it's a little bit more invasive than a vasectomy. And so the truth is vasectomies are far more common, and the male should probably, if there's going to be a surgical method, the male should pretty much volunteer to do that. Just saying. And so finally, I was mentioning these sexually transmitted diseases. There's a whole slew of them. And they can be anywhere from an annoyance to potentially fatal and even sterilizing a female if you get these. And they result from sexual contact, and so they're transmitted from person to person through sexual fluids. And then maybe worst of all is HIV, which can result in AIDS, and it can be fatal. And this is result from, again, unprotected sex or sharing hypodermic needles, and so that's, again, to be avoided. So here's the thing. You don't know if someone's sick. You don't know if somebody is carrying a virus. You don't want to become pregnant unless it's time, you're in the perfect place, and so you must be prepared. And so the body, all these years of evolution have adapted the male and female body to become pregnant. It's pretty easy to do. And so look forward to it. Treat this positively. Be excited about it. It's a wonderful thing. Chance to have children. It's the greatest thing in the world. But if you don't want it, take care to prevent it. So I hope you enjoyed this video on hormonal control and female reproductive system. Thanks for watching.